Hi, this is Ryan Kelly, Managing Editor for the Journal of Emergency Medical Services, and I'm here with Dr. James Woodson, who is one of the winners of the EMS10 Innovators in EMS Awards for 2016. Dr. Woodson, it's good to meet you.
Yes, sir, you too.
And so you won this award for your development of an app for pre-hospital alerting called Pulsara. Can you tell us a little bit about the app and how you developed it?
Sure. So imagine yourself 2 a.m., wake up all diaphoretic, crushing chest pain, nauseated, you know you're having the heart attack, you're having the big one. So if you call a medic, you call 911, a medic shows up, basically they'll do an ECG and they see that you're having the heart attack. So from there, what typically happens is they Bluetooth the ECG into an old-fashioned modem, send it to a receiving station, the hospital gets it by fax or email, and then they typically have to pick up a two-way handheld radio. So nice modern technology, right? So they call in a radio report. The hospital gets that. They send off a blast page. Everybody gets that page, and they call an operator who checks off a piece of paper who received the alert. And then from there, it's a ton of phone calls and pages, often going through middlemen. So what we basically do is we move all communication over to this thing. So everything is on mobile technology, so we can basically cross all EMS agencies and all hospitals to truly create a regional system of care where you can instantly spin up a team and everybody's on the same page.
So how does that work exactly? I mean, how do you get all of those parties to communicate over just a simple cell phone? They just use their own phones, or?
Right. Yeah, so there's a couple of components. One is, how do you get a region to move towards this technology? I think we all know that we're not going to be using fax machines and emails and pagers, handheld radios in 10 years. But what hasn't been done before is figuring out how to convert a system over to mobile technology. And so a lot of that, we actually give pre-hospital communication away for free. So it helps enable the region to convert over to this technology. So that's one component of it. So basically it's free to the hospital, free to EMS. So there's a huge value proposition to start the platform moving forward. The second thing is switching costs for hardware. We all carry these smartphones in our pocket. It has cellular, it has Wi-Fi, it has geolocation, Bluetooth, the list goes on and on what's in that technology. And we all carry it in our pocket. So we typically get a page anyway and pick up our cell phone and call. So now we're just getting the alert and the information's on there. So we leverage bring your own device very heavily. Typically the hardware cost for a hospital is one dedicated iPad for the person that normally manages the old-fashioned radio report.
Wow, that's amazing. And so how do you ensure the privacy of patient information and the security that I would imagine would be needed for the healthcare environment?
Sure, yeah, so it's fully HIPAA compliant. Old school way to do it was you had to have the ability to remote wipe a device and that kind of stuff. Well, we basically have connectivity. You have to have connectivity, and we push everything to the cloud. So nothing is stored on the device. So we have the same username, password, and security measures that things like EHRs and those type of things do. We encrypt everything at rest and on the fly, and then nothing's stored on the device. So even if you use the device to take a photo, it goes up to the cloud. It's not stored on your device. So there's never a reason for a court to subpoena a personal device, never a reason for your hospital or EMS administrator to remote wipe it because there's nothing on it.
Wow. So do you see this being used for other types of pre-hospital alerts in the future? I mean, could it be used for sepsis, for example, or other alerting, other needs that you might have to alert the hospital?
Sure, absolutely. Yeah, the first things that we're tackling are the time-sensitive emergencies.
Mm-hmm.
So STEMI and stroke, we do end-to-end right now. We also throw everything else can be done under general patient. So that old-fashioned radio report that all medics love and all EDs love to receive goes away.
Mm-hmm.
So we can do that now, and again, that's for free. So we can handle all those in the pre-hospital space now, but end-to-end to truly drive the patients through, we're going to be doing the other time-sensitive emergencies. So trauma, sepsis, and cardiac arrest are next in line.
Well, thank you, Dr. Woodson. It was a pleasure meeting you.
Yes, sir. Thank you.
This has been Ryan Kelly for the Journal of Emergency Medical Services, and I'm here with Dr. James Woodson, one of the EMS10 Innovators in EMS Award winners for 2016.